President Obama asked me to join his health care summit, and I told him I would, and I support the public option. And I've heard a lot of comment favorable about the single payer, and I think it all ought to be on the table. I'm prepared to have everything on the table. I have to tell you that single payer doesn't have a whole lot of support in the Congress, but I think when we're structuring the bill, we ought to be open to any suggestion and any idea and think about all the possibilities and not be restrictive.
As a small business owner, I'm hoping that help for small businesses will be addressed with a health care plan, because I feel health insurance can't be tied to your employer. One, because small businesses can't afford it, and two, if you lose your job, you're done. Thank you.
Well, the plans are to look out for the small business owner, and the cost of health care has just enormously increased. The projections are that what cost $5,000 in 1996 cost about almost $12,000 in 2007, and projecting ahead to 2016 or 17 to be about $24,000. So you got to control costs, and the plan is to control costs by making available an annual exam. Don't have to take it, but it's available. And people are likely to take an exam if they don't have to pay for it. They're expensive, but if insurance is covering it, they'll do it. Then you have early detection of things like breast cancer or heart condition, high blood pressure, etc. And that's designed to bring down costs. Also, to have jail sentences for people who commit Medicare or Medicaid fraud. If you just give them a fine, it's like a license to steal. So there's going to be a direction for small business.
Senator, a couple of weeks ago, Fortune magazine came out with an article that talked about the 5 freedoms Americans would lose under the president's health care plan. And it talked about, freedom to choose what's in your plan is something that we would lose. Freedom to be rewarded for healthy living. Freedom to choose high deductible coverage. Freedom to keep your existing plan. Freedom to choose your doctors. Is your sense that these portrayals are accurate in this article?
All wrong.
Can you talk about that?
Yeah. You'll have the freedom to choose your own doctor. Read them down the list and I'll deal with them specifically.
How about that one first? Freedom to choose your doctor.
Yes, sir.
And then they had freedom to keep your existing plan.
Definitely the case. You'll have options, but you can keep your own plan.
Freedom to choose high deductible coverage.
High deductible coverage? No, you can do that if you want it.
Freedom to be rewarded for healthy living.
Freedom to be rewarded?
For healthy living or pay your real costs.
Well, there are going to be incentives in the plan like Safeway has. If you don't smoke, you get a lower premium. They're going to check your cholesterol. If your cholesterol is good, you'll get a lower premium. So you'll benefit from a healthy lifestyle.
And the other one was freedom to choose what's in your plan.
No, you'll have a whole range of choices. That's why we talk about the public option. It's an option contrasted with a private option. It's up to you. You want one, you get what you want. Number 5.
That's the kind of advertising we need.
What's that?
That's the kind of advertising we need.
Well, that's the fact.
One of the freedoms that I'd like to come away from this health care is the freedom from bloated salaries that eat into the revenue that ought to be going into health care. I know you say
Cap it.
well, it seems to me
Cap and
that
trade.
well, that's Congress can address that perhaps with the tax system too. But if there is not some sort of a public alternative, I don't know what's going to give them the competition to bring those bloated costs down.
Well, that's exactly what President Obama says. That's why he wants a public option. The public option will not have a profit in it. It's going to be a level playing field, but won't have the profit. And President Obama is pretty blunt about it. It's going to keep the private sector honest. Nothing wrong with that. It's a privilege to be one of your senators. I bring you greetings from Senator Casey, whom I work with very closely, and also Governor Rendell, whom I work with very closely. Thank you all very much.